Okay, and we are about 2 after the hour, so let's begin. I want to welcome everyone to our March MMS info session. These info sessions are offered under the CMS Measures Management System contract led by Battelle. I am Kate Buchanan, and I support the education outreach efforts on this project. And today's session is a presentation from our own Maureen Hammer and Jake Webb, who on the recently released CMIT 2.0. So we can go on to the next slide. These info sessions are part of an ongoing effort to engage measure developers and other stakeholders in quality measurement topics. Among the stakeholder engagement activities we conduct are annual public webinars on high priority CMS topics. Our first annual webinar of 2022 will actually be in April, discussing how CMS initiatives improve rural health. So please stay tuned for more information about how to register towards the end of today's session. And then before we get into today's topic, I do want to go over a couple of housekeeping items. So can we move on to the next slide? Great. First of all, today's session is being recorded. Second, all participants will be muted during the call. You can enter questions in the Q&A feature. We will have an opportunity for Q&A at the end of the call, but we encourage you to submit questions throughout the presentation. The Q&A window is at the bottom right of your screen. If you do not see it, we recommend clicking on the 3 dots. If you click on that, then you will get the pop-up for the Q&A. Finally, the presentation slides from today are posted on the MMS website. The link to these slides we put in the chat window momentarily, and we will also be sharing additional resources throughout the presentation in the chat function. So with that, I'm actually going to turn it over to my colleague, Mary Sheehan, to provide a little bit more detail on MMS. Mary?
Great. Thank you so much, Kate, and thank you everyone for joining us today. I'm really excited to have the team share the CMIT 2.0 updates with you today. And I just wanted to help connect a little bit of the dots around what is the measures management system, since we host these webinars, but now we're also introducing you to these tools. And so I just wanted to provide a quick overview for you. The measures management system is a standardized system for developing and maintaining quality measures that are used in the CMS initiatives and programs. We support quality-related activities across the CMS agency, and we really are looking to provide support and guidance to measure developers to help develop the highest caliber quality measures and also to educate and inform our stakeholders. Through the work that we do, we really focus on trying to provide innovation to help create efficiencies in the measure development process, but also to provide transparency and make sure that everyone is in alignment on how to develop quality measures and how to access resources to be able to develop those quality measures. So as part of that, Kate mentioned that we do this webinar series, but you may also be familiar with some of the other activities that we do. We support the pre-rulemaking activities that CMS does, specifically with the submission of quality measures through the merit tool. And I just wanted to plug a little reminder that tomorrow we are having a pre-rulemaking kickoff webinar. So if you haven't already had a chance to sign up and register for that, that is happening tomorrow. So if you want to join us, please go ahead and do so. And I do want to just encourage folks to, if you haven't already signed up for our listserv, to go ahead and do that. You can email mmssupport@battelle.org to request being added to our listserv so that you can have the latest and greatest information coming out of the different work that we do. So with that, I'm going to go ahead and turn it over to Maureen Hammer, who is one of the lead folks in the development of CMIT 2.0 to talk us through all of the updates that have been made over the past year. Thank you.
Thank you, Mary. Good afternoon, everyone, and thank you for joining us for this information session. Before I jump into telling you about the new features, I'd like to give you a little bit of background on why we decided to move CMIT forward into 2.0. With the initial development of CMIT, we sought to provide a comprehensive repository of CMS measures that compiled measure information from government documents like federal rules and program call letters, to allow quality measurement stakeholders, CMS staff and contractors, and the public easy access to all of that measure information. In the summer of 2020, CMS was looking to use CMIT to assist their efforts in reviewing measures being used across various payment and performance programs to reduce redundancy and burden. There were a few issues we noticed related to the data structure of the measure information when trying to compare across multiple programs. This included things like no standardization in some fields, such as data source, the terminology for how programs use measures, and programs implementing a given measure somewhat differently than another program that would ultimately make it a different measure. To help address this issue, we evaluated our database usability and the way we structure the measure information within that database to help make it more useful for CMS and measurement stakeholders to be able to find the same measure information they were used to seeing in CMIT, but also allowing them to be able to query information to answer more advanced searches. We applied human-centric design principles and conducted user testing with CMS and stakeholders throughout the development process and are excited to provide you with an overview of the newly released CMIT 2.0 today. Before my colleague Jake Webb walks you through the live demo, I want to take you through the work we did in restructuring the data and familiarizing you with our terminology. Next slide, please. So what is CMIT? Next slide. CMIT is the host site for the CMS Measures Inventory. These are measures that CMS uses to promote healthcare quality and quality improvement. Each measure record will provide you with detailed information such as the rationale, numerator, denominator, etc. for the measure. Next slide, please. CMIT provides stakeholders access to information about quality measures, such as what programs are using which measures and how many unique measures are in use. It promotes transparency, supports the coordination of quality improvement efforts, enables public participation in quality measurement, and fosters measure harmonization and alignment, as well as helps to identify measurement gaps. Next slide, please. The CMS Quality Measures Inventory includes measures in CMS programs that are subject to the federal rulemaking process and have been proposed, finalized, implemented, or removed. It includes measures under development and measures under consideration for these programs. And it includes measures used in many programs and initiatives that are not subject to the federal rulemaking process, including measures that may be part of CMS models or initiatives. So where does the data come from? Data sources include federal rules, measure specification manuals, and information from the CMS program and measure leads. The data is updated on a rolling basis, and the measure information is then validated by CMS program and measure leads. Next slide, please. And now I would like to share some key features of CMIT 2.0 with you. Next slide, please. So what has changed? We have a new format for the CMIT ID. We redesigned the site to include a more flexible infrastructure to support future needs and to improve usability. We standardized data fields and added additional information, such as noting when a measure has been risk adjusted. We also provided you with ways to more easily group and count measures, such as the Measures in Use tab, which will show you all the variant measures within the unique families. Next slide, please. The new CMIT ID has 3 parts. The first part indicates the standard ID followed by the format, which will be either a clinical quality measure or an electronic clinical quality measure. And the third part tells you which program is using that measure. So now let's take a closer look. Next slide, please. The standard ID helps to calculate the number of unique measures. If you add on the format, you can now see how many unique clinical quality measures and unique electronic clinical quality measures there are. And with the addition of the program, you can see what measures are being shared. Note that in most cases, the standard ID will include the old CMIT ID that you're used to. Next slide, please. So how are families organized? They all belong, how are measures organized? My apologies. They all belong to a family. So families are made up of measures that have been grouped together based on measure concepts, such as controlling high blood pressure. Standard measures in a family all have the same measure concept, but are considered to be substantively different from each other because, for example, they are a core measure, they have a different care setting, have a different population, or have different data source. For example, one measure may be used in a nursing home and one in a hospital. Notice that each standard measure can have multiple associated variants of the standard measure that belong to different programs. Next slide, please. So to recap, the new organization of measures starts with families, which are made up of measure concepts such as those that are shown on the slide. Next slide, please. This slide shows you an example of a family with 4 standard measures and 7 variants. Let's go to the next slide to take a closer look. The family concept is controlling high blood pressure. Within that concept, we have 4 standard measures in the family. Remember, we have standards because the measures are substantively different from each other. In this case, reasons include things like different populations or care settings. Programs then create variants of the standard measure they want to use. In this case, as you can see on the slide, 3 programs have elected to use the standard measure 01246. I would like to reassure you that there is a quick start guide and a short video linked on the homepage of CMIT that you can read or view later that will walk you through this same information about the new CMIT ID structure and the site structure as well. Next slide, please. But for now, I'd like to take you on and show you some of the increased usability that we have added to the system. So on the home page for CMIT, you will find cards for pre-filtered searches to quickly see those measures that have been endorsed or those that are electronic clinical quality measures. If you choose to create an account on CMIT, you can also create and save your own searches. Next slide, please. When you click on the full measure inventory, you will see that you can now group measures differently. The default view is by program, which will show you all the active variant measures that are in use by programs. You can also group by measure. This will show you all the standard measures and their associated variant measures, or you can group by family to see the families and their associated standard measures. Next slide, please. We also provided a way for you to see the results in a table format. This is the default view, and you'll notice that you can add or remove columns from this table to make it easier for you to sort. You can also elect to use the list view. In the list view, you'll see a card for each measure that will provide you with additional information such as milestones. Next slide, please. As I mentioned earlier, we standardize entries for selected fields to improve searching and sorting. Some of those fields included conditions or subconditions, or care settings, or level of analysis. Next slide, please. And we added some additional fields to provide more information, such as whether a measure was risk adjusted or if it was CMS funded. That was a lot of information to take in, and we will be happy to answer your questions. But first, let me turn it over to my colleague Jake to walk us through a couple of scenarios using CMIT and to show you some of what I have highlighted. Jake.
Thank you, Maureen. Hello, everyone. So in this demo, I will be showing you the upgrades that we have made to CMIT, along with going through some scenarios to give you a first-hand look on how to complete some potential tasks. I do want to reiterate that with this update to CMIT 2.0, we have not removed any of the past features or information. All the features and measure information that you were able to do or collect in version 1 are still available in 2.0. We have just added additional features and measure information to further assist you. With that being said, let's jump right in. So here is the homepage for CMIT 2.0. The first thing that I want to point out is the banners in the search bar at the top. The banner includes pages such as Measure Inventory, Measure Summary, Measures in Use, which is new to 2.0, and the Environmental Scan. Throughout this demo, we will discuss each of these and their uses. You will also see the search bar at the homepage. If you already know what measures you would like to look up, just simply type in the measure title or the CMIT reference number and it will take you to that measure. To the right of the search bar, you will see the How Do I Search. If you click on that, you will get some best practices and useful tips to assist you in searching for specific things. I would recommend taking a look at this if you are not getting quite the exact results that you were hoping for. Below the search bar to the right, you will see a Request an Account section. While you do not need to have an account to use CMIT, there are added benefits to having your own account. Throughout this demonstration, I will go into more detail on what those benefits are. To request an account, simply just click on the Request Account button and fill out the personal information form. One new upgrade that we have to make this process a little bit easier is you may now select all the sites you would like to have access to, whether that be simply just a CMIT or CMIT and Merit, or if you are a CMS or MIDS contractor, also the MIDS library. After you have filled out this information, submit your request and we'll get back to you as soon as we can. I also want to point out on the homepage, there are the additional resources that Maureen has mentioned to assist you in learning about the new 2.0. Right below the Welcome to Measures Inventory Tool header, you will see a link to a short 4-minute video that provides information on the latest features, along with a link to the CMIT user guide. A new feature to 2.0 is the quick access pre-filter options that you see here. The ECQMs and endorsement measures have been filtered and placed on the homepage for a quick search. As mentioned earlier, one of the benefits to having an account is being able to create and save your own customized views based off of any combination of filters that are available to you in 2.0. I will show you these filters in just a little bit. But finally, to wrap up on the homepage, you will see at the bottom of the page that there are some quick links to additional tools and resources that may be beneficial to your work depending on your roles. So now let's take a look at the Measures Inventory page. From the home screen, there are 2 different ways to get to the Measures Inventory page. One is by clicking on the Measures Inventory tab up in the banner, or by pressing the View Full Measures Inventory button in the middle of the page. Both will take you to the exact same page. When you first enter into the Measure Inventory page, you'll see that CMIT defaults to showing all active measures in CMIT. I point this out because if you're searching for a measure and you cannot find it, it could mean that it is not active. You would just simply need to uncheck it, which would remove that filter, and now you would be able to see all the measures in CMIT. So for this example, right now you can see that there are 930 individual measures that are active, but once I remove this filter, it should reload and we should have a different number that will show all measures that are active, inactive, development, and pending. And as you can see, there's a larger number. I also want to point out that CMIT defaults to 20 measures a page. To see more measures, simply select the Load More button and additional measures will pop up. I also want to mention that we have added a Return to Top function that'll take you directly to the top of the page. CMIT 2.0 now has 2 different display formats. The display you now see is in a table format. This is the standard default and lays out information into columns. You are able to choose what columns you would like to present. Simply click on the Show Hide Columns, and you can pick and choose what information you would like to see on the home page. For example, let's say that I would not like to see reporting status, but I would like to see information on data sources. I would simply uncheck the reporting status and come up here and just check the data sources and click the Save button. And now you can see that data sources has been updated to the table. The second display is a list format. This is a more clean and simplistic format that will provide the users with the basic information on the measures in a card-like format. This format cannot be edited, but shows users at a quick glance the program, the status, start and end dates, and if you select the View Details button, it'll also show milestones and program and model notes. Another added feature to CMIT 2.0 is the Group By feature. As mentioned earlier in the presentation, the reason for multiple views of measures is to make exploring the alignment and relationships easier. CMIT's default is the Group Program. Program View shows us what measures are in each program, and you are able to quickly see what the measure is and what program it is in. However, sometimes measures cannot be adopted by multiple programs, and programs might need to slightly alter that measure to better fit their program. And at that point, we would need to start looking at the measure view. Measure view shows us substantively different measures. You'll see that on the screen that there is a standard measure title, and then there are measure titles. At this level, you will be seeing that for each standard measure title, there are variants to that measure that fall in different programs. As you can see on the screen in this first option, that there are 3 variants that are in 3 different programs, which again, you can tell by the CMIT reference number. But even though that they are in different programs, they have the same standard measure core. Finally, the third grouping is going to be families. This is where you would look to see for unique measures. Families focus on the same measure concept and made up of 1 or more standard measures. So if we look at family measure ID 671 as an example, hopefully this will show you the different layers to each group. And as we can see, there are going to be 7 different variants in the program level. However, when you're looking at the section of the first section of the CMIT reference number, I can tell that there are going to be 3 standards, as 5 of these variants have the same first 5 numbers identifying that they are going to be in the same standard. Once we get to the standard measure title view, you can see that based off of these titles, each are substantively different from each other, although they address the same measure concept, which leads us to the families. Families identifies that the 3 standards are similar to each other, but may have a different population or setting. As all of these standard measures and program variants address the same measure concept, we consider the family to be a unique measure, which in this case would be the ability to participate in social roles and activities, the promise. Another easy way to look at this is up here with the numbers. So if we start at the beginning at program and we take off the active measures, you're going to see a number of 4,987 individual measures pop up. And give it a second. So there's the 4,987. If we then move to the measures, you're going to see that the numbers drop to 2,247. And then finally, if we move down to the families, you're going to see that that number drops again to 1,627 families of measures or unique measures that are all in CMIT. Another thing that I want to point out with 2.0 is that we have cleaned up the filter section to be more concise and easier to navigate. As shown here, you can see that you can filter from many different sections, such as program, reporting status, conditions and subconditions, and many more. To easily show what filters are being applied, all filters selected will show up at the top of the page in blue. If you wish to remove a measure, simply press the X on the selection. At this time, the program group is the only group that has these filters. However, CMIT is an always growing and evolving tool. With that being said, expect in the following weeks to have filtering capabilities for the measurements and family groups as well. Similar to the previous CMIT, you are still able to export an Excel file showing all the filters and columns that you have selected. Simply press the Export Excel file and an Excel spreadsheet will begin downloading onto your computer. If you wish to reset your page back to the standard CMIT default settings, click on the Reset button and all columns and filters will be set back to default. So as I click on this, if we had any filters or if we remove the active, it would automatically regenerate back to just the active. But you'll also see that the reporting status has now been re-added and the other one has been removed. So this is nice. So if you have a lot of filters on there and you just want to go back to the default setting, and start again, you have that capability now. The final upgrade I want to mention on the Measures Inventory page is the Measure Comparison tool. As you can see on the left of the measures, there are buttons to add measure comparisons, along with a blue box in the lower right. As you find measures that you would like to compare, press the Add to Measure Comparison buttons and they'll show up in the box. You may choose up to 3 measures to compare at a time. Once you have selected the measures you would like to compare, press on the blue box and the options to download an Excel file or compare via the CMIT will pop up. Once you have completed your comparison, simply press on the X to remove from the comparison tools. Before we move on to the next section, let's take a look at the changes that are made inside the measure information sections. First thing that you'll notice with this, which is different from CMIT 1.0, is the layout of the page. We have updated the layout of the page to match similar tools like Merit To minimize confusion and to give the tools a more standardized look, we now have the tabs to the left of the text and not on the top of the page. As Maureen mentioned in the beginning of this presentation, no measure information was removed in the update. However, we have added a few additional data fields that I would like to point out. Under the Properties tab, which is of the standard default, we have added the measures of risk adjusted, so we can tell if it's risk adjusted or not. Under Stewards tabs, we have added if the measure is CMS funded or not. Under Characteristic tabs, we have added a spot to identify the year that a measure's CBE endorsement was removed, if applicable. We have also added the format type to identify if the measure is a CQM or an ECQM. Speaking of whether a measure is CQM or ECQM, I just wanted to point out again that you can now identify that in the CMIT reference number or variant ID by looking at the middle letter. In this case, it is a C, so it is a CQM. So that's why it matches down here. I also want to mention that we have added a Family Measures tab to help identify other standards that are in that family. And then finally, the last new addition on this I want to point out is the Components tab. The Components tab will be used for component measures to lay out their specifications. Now I want to quickly go through some of the other tabs that you see. So the first one is the Measure Summary. Measure Summary is a tool that will allow for you to compare two different filters to each other. As you see here, this is the standard default options. This is showing the programs and how many measures are in each of the reporting statuses. This is an exceptionally useful tool if you are looking for a statistical information. Some of the other options or filters that you can choose from are programs, reporting status, measure type, meaningful measure areas, healthcare priority, CBE endorsement status, care settings, and data sources. And these are going to be the same for both sides. One thing I do want to point out with this page is it's very nice. So if you're looking at this, and for example, if you're looking at the skilled nursing facility quality reporting, and you see that there are 11 active measures, and you would like to see what those measures are, instead of having to go back to the Measures Inventory Tool and having to add those filters in yourself, you can simply just click on this number, and it'll actually add in all those filters, and it'll show you all the active measures. So if you're looking at that tool and you just want more information, you can simply click on each of the highlighted numbers. The next tab is going to be the Measures in Use tab, which is a new feature to 2.0. The Measures in Use is used to identify aligned measures to determine if a measure is unique. This tab shows a running list of all active measures that are currently being used. The 540 measure results that you see up here are unique measures, and it is the count of the family name section. To the right of the family names, you will see the list of all the measures and what programs they are active in. Again, you can tell what program they are active in based on the CMIT reference number. You do also have the option to export this section as well. Similar to the measure inventory section, by exporting on this page, you'll have a list of all active unique measures. Lastly, we now have the environmental scan tool. This tab explains what the environmental scan tool is and how it works. On this page, you'll see additional resources to assist you in using the environmental scan tool, as well as some frequently asked questions. As you might have saw a few moments ago, each measure has an environmental scan tab in their measures, and that is available to all users of CMIT. The environmental scan tool is updated monthly and indexes 60 relevant abstracts and articles from PubMed, PubMed Central, and CIN-AHL for quality measures found in the CMS Measure Inventory. So let's close the demonstration with a scenario. Let's say that you are doing a report on how CMS is using measures to address a specific clinical condition. For this scenario, let's say it's HIV. You would like to see how many programs have an active measure with a condition or subcondition of HIV. First, we would need to go to the Measures Inventory page. We then want to make sure that we have just an active reporting status, and because we were doing previous work, it's not just showing active, so we're going to click the reset. So only the active filter is selected. We are then going to go into Add Filters, and we're going to try to find the HIV. So we're going to go down to the Conditions and Subconditions. You'll see under the Conditions that the responses are more general, whereas if you select the Subconditions, you get a more specific options, and this is actually where you'll find the HIV. I will click on it, and then I want to verify that CMIT has recorded my selection. I will select to see if my filter was added to the top, which it looks like it has. And from here, we can go ahead and click on the Apply Filters. This step would be the same for any filter you would decide to choose from, whether that be care settings, conditions, types, groups, etc. It would be the same steps. Now, it looks like we have 6 active measures that meets our filters. This shows that there are 6 measures that are active and that have a condition subcondition of HIV. From this, you can also see that there are 3 different programs that use these measures. In this case, it would be the Doctors and Clinicians Compare, the MIPS program, and the Medicaid Adult Core Set. It also looks like there are 2 sets of measures that are in multiple programs. As a reminder, you can identify this in 2 different ways. One is by looking at the CMIT reference number and seeing that the 2 measures have a matching initial information, or the other is by the program tab to the right of the measure titles. So for this example, for the first one, the HIV medical visit frequency, you can see that the CMIT reference are the same until you get to the program. You can also see that the titles match exactly, but there are 2 different programs. Similar to the HIV viral load suppression. The CMIT reference numbers are the same until you get to the programs. The titles are the same, but they have 2 different programs. So then let's say that after you have this information, you would like to see all of the measure families related to HIV care across all of CMS programs. There are 2 different ways to do this. For the first one, the first thing you would do is click on the measure title. You're then going to want to go to the Family Measures tab. This will show you all the measures and families related to HIV once it loads. So here you can see all the measure families with the standard ID numbers here. Another way to do this is once the filters have been added to the family group section here on the measures inventory page, you can simply go to the families, and once the filters are here, you click the filters and then just filter by the HIV subconditions and conditions. You would have the same results, just in less steps. And that will wrap up my demonstration portion, and I thank you for your time. And as you're going through CMIT and you have any questions or suggestions, feel free to reach out to us using the Contact Us button at the bottom of the page. And I'll click on that just so you can see what it looks like. And thank you, and I'll go back to you.
Wonderful. Thank you so much, Jake. So we have been getting some great questions in the Q&A. I'd like to encourage people to continue to submit them. And while that is happening, I did also want to point up in the chat, you can find the links to today's slide presentation, the CMIT website, the CMIT user guide, as well as that video that Maureen mentioned, walking people through some of the new features. So there are a couple of questions that we have, and I think we should get started. One of them is, with the new CMIT structure, how frequently is the data updated, and what is the process for updating it?
Yeah, so I can take that one.
Maureen or Mayor? Oh, great. Thanks, Jake.
Yeah. So for measures used in programs that utilize the formal federal rulemaking process, we update CMIT based on their proposed and final rule schedules, typically in the May, June, and November, December timeframes. For programs that don't utilize that formal rulemaking process, we update those annually unless requested by the CMS program leads. As in process, we use the proposed and final rules as our main source for updating these measures as they come directly from the programs and the program leads.
Great. And Jake, actually, I think one of the things that would be helpful is if you wouldn't mind to go back to share your screen, because we have some questions about filters, and I think it was beneficial if people were able to see it. And while that's happening, I don't know, Maureen or Mary, if you wanted to take the question of, what are active versus inactive measures?
I can take that one, Kate. Can you hear me okay?
Yes, thank you.
Okay, perfect. So for active measures at this point, what that means is the measure is currently being reported on. So the programs are actively collecting data on that given measure. And so those are typically the ones when someone says, this is being used by that program, that's what that means. Inactive would be that it's no longer collecting data, and so it's no longer required to have any sort of reporting. It's not to say that it couldn't, come back into data reporting in the future, but just given, that specific moment in time, it's not actively collecting data. So those are the definitions there. I think it's also important, actually, now, Jake, that you're sharing your screen. If you want to hover over that reporting status, some of the features that were added show that it provides a little bit of a definition for you. So if you hover over there, it shows you this refers to the status of the measure in terms of data collection for mandatory or voluntary reporting. So there are some hopefully helpful tips in there for you. Thanks.
Thank you, Mary. And so, Jake, while we have this up here, one of the questions that we received is there a filter for the seeing if a measure is part of the core quality measures collaborative measure set? Would you be able to pull that up?
Yeah, you said the core measure sets. Is that what you asked?
Yes.
Yep. So there is a filter for that. So if you just click on the core measure set, it'll pop up with all these different options.
Wonderful.
And I'll leave this up so people can take a quick look at it.
And this is also another question we had, is looking at all measures reported in a program. And I know that you briefly mentioned that, but if you wouldn't mind just going back and showing where people can find the filter in order to filter measures by program.
Yeah, so actually it's going to be in the same spot as well. So if you go to the add filters, you can actually filter by each program by just clicking the top program. And this will show all the measures that are all the programs that are in CMIT. And you're going to see some of them are grayed out right now, and that's because we have that active filter in here. If we would take off that active filter, you should see that some will pop up that'll become ungrayed, but you'll also see a lot of these numbers are going to pop up larger because it's adding more measures into that field. So like right for this ambulatory surgery center quality reporting, you see the 18. That means that there are 18 measures that'll pop up if you click the apply filters. So you'll see 18 measures here.
Wonderful, thank you. And we did receive a question about what CBE stands for, and just wanted to clarify that that is ConsensusBased Entity, and NQF is currently the organization that holds that contract with CMS. And so that reflects some of the NQF information when it says CBE. Another question that we received is, are there plans to, one, add NQF endorsement maintenance information? I believe we addressed that with some of the CBE, as well as adding QCDR measures to help with environmental scans for related or competing measures. And that will be in support of development of new measures.
Yeah, Kate, this is Mary. I'll take that one. And QCDR is constantly sort of a hot topic, and we've gone back and forth with CMS several times about, the value in trying to add and maintain those measures within CMIT. At this time, the answer is no. I don't think we're going to be looking to incorporate QCDR measures. That's, again, it's not to say that we'll never revisit that decision. I think probably annually that comes up and we consider our options. I appreciate the additional context to sort of say what that could help with. So I certainly think that we can take that as part of our conversations the next time we think about that. But at this point, the answer is no on the QCDR measures. Thanks.
Thank you, Mary. And one of the questions that we had that I wanted to just quickly answer was, is there a field that indicates if the measure matched the U.S. Preventative Service Task Force recommendations? And right now there is not. And then I did have, Maureen, a question for you, which is, do we have a library of acronyms used today?
We do have one that is compiled. It will be added to the site in the next couple of weeks.
Great, thank you. And then, sorry, just looking through some of the questions that we received. And so I wanted to know if there were any plans to add additional IDs One of them was the ECQM IDs or CMS Q IDs. So I didn't know if there was, yeah, just if the question was, are there plans to add additional information about measure IDs? So two of the examples given were CMS Q IDs, ECQM IDs. So wanted to know if there were any plans to do that. I will note that one of the questions was the NQF ID, and wanted to mention that when we say CDE ID, that is referring to the consensus-based entity, which is NQF.
So there are not plans for the ECQM ID yet. You will find links to their site from the measure in question, so you can find it there.
Great. And the next question we have is for Mary, which is, has CMIT considered creating website functionality for updates to be submitted for consideration directly through the website rather than Excel spreadsheet?
Yes, so thank you. This is must be a question from someone intimately involved in our update process. So yeah, we are very excited to say that we will no longer be doing updates from an Excel file. And so I think you'll see from the landing page in CMIT that there's an option for a login. So there is an opportunity for people to create accounts. I think Maureen talked a little bit about some of the features that you have the benefit of with an account. One of the things that an account will grant you specifically as a CMS user and as a contractor for CMS is the ability to access what's called the revision dashboard. So all updates to the inventory will be made through that revision dashboard. And so we're really excited about that. We also did not enjoy the Excel file update. There was lots of room for error and, and possibly translational issues as we copy and pasted things into the database. So this was a really exciting move for us, and we've gone through that revision dashboard process with CMS before we launched this. And I think we've got some great headway in being able to improve that process and not using Excel. So I'm excited about that one.
Wonderful. Thank you. And we're having a couple additional questions coming in. And so one of the questions we received is, if the measure is not endorsed, does it mean that it has not undergone a consensus-based review?
Not necessarily. So, yeah, can you hear me? Yes. Okay, thanks. Yeah, so if there's a measure that does not have a CBE endorsement status or identifier, it doesn't necessarily mean that it hasn't gone through. It could mean that the measure is no longer endorsed, or it could be that, it was a measure, like for example, in some of our post-acute programs, there are measures that they take and apply it to a different setting. So maybe it was endorsed for a specific setting, but then when they apply it in a different setting, it makes it not endorsed. So there's a few different reasons why it might not, but it doesn't necessarily mean that it has not been submitted.
Great, thank you. Let's see, I think that we are actually slowing down on questions. So I'm going to move to the announcement section, and if we have any other questions pop up that we think would be really beneficial for people to know, then we will ask. So
Kate?
Oh yes, please go ahead. Yes.
Yeah, I wanted to circle back on one of the questions someone had asked about the QPP identifiers and some of the ECQM identifiers as well. Maureen had mentioned that there's a link in the ECQI, or I'm sorry, to the ECQI Resource Center for some of the ECQM specifications. And I just wanted to mention where you can find that. So if you go into a measure that is an ECQM and you click on the groups tab, Then from there, you'll see that link to the ECQI Resource Center for that specific measure. But also in there, you'll see measure groups, and that's where if there's a program-specific identifier, like the QPP number, you'll find it there as well. So think, whether it's a QPP ID, some other programs have, short abbreviated names like ASC-07 or something like that. You'll find those in the groups tab as well. Sorry to interrupt you there, Kate.
Oh, I appreciate it. Thank you. Okay, so can we go to the next slide? So I wanted to let everyone know, in case they missed it, that the February information session, 2022 merit demonstration from PROMs to ProPMs, developing patient-reported outcome performance measures, is now posted onto YouTube. So the brief CMS merit demo was the introduction to that one, and that will be relevant because May 20th is the measure submission deadline. Also wanted to let people know that the upcoming info session is updates to the ECQI Resource Center. That will be on April 27th. I'm fast forwarding here, from 2 to 3 p.m. Eastern. And then we can move on to the next slide. And so speaking of rulemaking, so wanted to reinforce that tomorrow, Thursday, March 31st, from 2 to 3 p.m. Eastern, is the 2022 pre-rulemaking season kickoff webinar. And so you will learn about this year's pre-rulemaking process, requirements, and resources. CMS is also offering a CMS Merit Tips and Tricks session on Thursday, April 29th at 2 p.m. to review the ins and outs of the tools for merit submissions. So this is a reminder that for CMS Merit, we'll close for measure submissions on May 20th at 8 p.m. Eastern. And to stay up to date, we recommend you visit the CMS pre-rulemaking website. So once again, want to highlight tomorrow is the pre-rulemaking kickoff webinar from 2 to 3, and that measure submissions the deadline for measure submissions is May 20th at 8 p.m. Eastern. Next slide, please. So as I mentioned in the beginning, we are part of the work that we do under MMS as hosting annual public webinars. So on April, there are 2 offerings of the same webinar, and it is Rural Health Quality, how CMS initiatives improve how we measure and address gaps in care. That will be offered twice. So it'll be the same webinar offered twice, but we just wanted to give people an opportunity to choose a session that works best for their schedule. The first offering is Wednesday, April 20th from 3 to 4 p.m. Eastern, and the second is Thursday, April 21st from noon to 1 p.m. Eastern. So then I believe that is it, but yep. And here we have our contact information. Want to thank everyone very much for joining today for this very engaging conversation. And if you have any follow-up or contact information, please email us at mmssupport@battelle.org. And with that, I hope everyone has a wonderful rest of their day. Thank you all so much.